Good afternoon. I'm Dennis Willich with Nationwide Southwest. I'm here with David Huerta, and he's with Whole Person. We're going to talk a little bit about an exciting product today. Want everybody to listen very carefully. David, welcome aboard.
Well, thank you, Dennis.
For having me here. Let's talk about Whole Person.
I'd love to.
Let's start out. What is it about?
Whole Person Virtual Care, Dennis, is the solution that all employers should consider to give to their employees. We understand that the healthcare system is broken, with insurance premiums continuing to rise, with employees having to pay higher deductibles, higher co-payments, higher payroll deductions. And what Whole Person is this, it's not insurance, okay? It's not insurance. It just sits above every insurance company as a supplement. Whole Person Virtual Care is a virtual medical practice that sits above every insurance company, and it provides access to 3 types of practices, okay? The most important one for people is the urgent acute practice. Somebody needs help now. It's 2:00 in the morning. It's 3:00 in the afternoon on a Saturday. This is a place for people to turn to get the health care they need when they need it. Within 30 minutes of reaching out to a provider, they're going to get a call back from an emergency room trained provider within 30 minutes for a $0 copay. So what Whole Person Virtual Care does, is it eliminates access issues because people can't get in to see their doctor timely. It eliminates confusion because there's no deductible to meet. There's no complicated rules. And by using Whole Person, instead of going to an urgent care center or an emergency room for a non-emergency, it eliminates balance bills and fear of surprise bills. All of this for $0 copay. The Urgent Acute Center is staffed only by emergency room providers, emergency room trained providers who take shifts to cover that time. They're licensed in all 50 states, so it's available in your entire region. And again, it's 24/7, any time of the day or night or over the weekend. That urgent and acute practice, folks, represents calls. We get 92% of the calls come in for that because people need help when they need it. They don't want to have to wait for an appointment. They don't want to have to leave their home. So whether they're at home or they're on vacation in a hotel or at a VRBO, this plan will always be there for them to use. The second practice that employees or members have access to is a virtual primary care center. So virtual primary care practice for people that want to get continued care from the same provider. On the primary care side, you get to pick whether or not you want to keep the doctor. So you have continuity of care. Once they get to know you, you can keep them. I've had my primary care doctor, Dr. Britley, for 6 years until she wanted to be a full-time mom. But because they have all of my records, it's a virtual medical practice, Dennis. I want to stress that again, folks. It's not insurance. It's access to an actual medical practice that your employees and your family have access to without concern or complication. All of my medical records, since 2014 on the urgent care side, and all of my primary care records are kept by the practice. So when I call in the fall because I'm having a respiratory issue, they saw all of the past visits I had with my respiratory. I'm asthmatic. If it starts up here, I can't let it drop to my lungs because I'll have an issue. And so the doctor says, "Oh, I see you calling again for your upper respiratory. Did the last regimen of drugs that we prescribed work for you?" Which was basically an albuterol mist for my nebulizer, a decongestion, and a steroid. I said, yes, they prescribed the same thing because they had the records. And then I was fine a few days later. So that's primary care side. So if you want disease management, chronic illness, ongoing issues, you want to get your blood's measured, your blood draw for measurement of your blood, all of that's covered by the primary care practice. I had, again, I'm going to talk personal because it's easy for me to do. So having them as my primary care practice, virtual practice, I have my blood drawn every year. And so it was time. 3 weeks ago, they called me, ordered my blood labs. They sent it into LabCorp because that's who my medical insurance is with, or it has as in their network. Had my blood drawn, and I have an appointment with my doctor next week to go over the results, right? So it makes it easy. The third practice is still more. The third practice, Dennis, is a mental health practice. So for people that have, if you just want to talk to somebody, whether you think you have to or not, it's in the privacy of your home. There's no stigma attached to it. You could call from your car. And again, on the mental health side, Dennis, it's a growing number of calls coming in for that. We don't know who calls in. We don't want to know who calls in. But to give people the peace of mind of talking to somebody for any kind of issue. As people who know me know, I went through a divorce 3 years ago. It was a mental crisis for me. It was very stressful. I used it. I'm not shy to say I used the mental health component. Had the same doctor for 6 visits. That's all I needed at that point, and $0 copay each time. So it's a solution, everybody, that is a supplement to whatever insurance you provide. And even if you don't provide, we spoke to 2 members today that didn't have insurance because it's so expensive, but now they have coverage for their employees for medical care. And for the fee that we charge per employee per month, I had 2 people call it a no-brainer.
I can definitely see that. So you just mentioned you don't have to have any primary insurance in play. You can still get whole person.
Yes.
Okay.
Yes.
And tell me, what does it cost for whole person?
Oh, that's a great question. So we have 2 models, okay, because when Dennis and I first met, Dennis was like, my members need options. So he drove this one for us. So we have the business-to-business model where employers can purchase it from anywhere from $12 to $15 per employee per month. So $12 to $15 per employee per month. It's billed monthly, okay? And that covers the employee, his or her spouse, and their children to age 26. If somebody wants to buy it on their own, Dennis, we now have that option. It's called a direct-to-consumer option. And again, you would just go to our website for the direct-to-consumer version, click the Enroll Now button, put in who you want to cover in your family, and you make a one-time or an annual payment. The charge for that is $275 per year for you and your family. We take every credit card. We use Stripe as our processor and tried to make it easy for everybody.
That's good. Now, I know you say this is not insurance, and I want to go through that again. Make sure it's not insurance. So this is not for hospitalization and things like that. This is for more of the things, the day-to-day things that happen. You come down sick in the middle of the night.
Yep.
And you're running a fever or whatever.
Yep.
You call in. Tell me what goes on after that.
Oh my gosh. Okay. So you're exactly right. It's not insurance. It's for professional services only. You need to talk to a doctor for an issue that's physical or mental. Okay. That's what this is for. Access to a doctor's professional services. So if you call in because you have spots on your throat, okay, and the doctor, now these are emergency room trained docs. They know what if they're looking at strep throat, right? Yeah. They don't need a lab test to prove it. General primary care, DOs, general doctors will need you to go get a lab test because they're protecting themselves from medical malpractice. These men and women know strep throat. By the way, the other very common diagnosis is UTIs. A lot of ladies are surprised at that because they think they have to go do a urine test. It's not true. Now, if there's a red flag in her description of what's wrong, they may ask to go get a test done. Okay. But these doctors are so highly trained, Dennis, that when the call goes in, a diagnosis and treatment plan is given, which happens 96% of the time. That's a very high number. 96% of the calls are diagnosed and treated on the first call, which eliminates all of these follow-ups that general doctors would require. So they prescribe to you amoxicillin for your strep throat. They're going to ask you, what pharmacy would you like that called into? You're going to give them the pharmacy you always go to, whether it's CVS, Walgreens, a local mom and pop. When you go pick up your prescription, folks, that's when you give your insurance card if you have insurance. Okay, and then you would pay the appropriate copayment if it's a generic or name brand or non-formulary drug. If you don't have insurance and the doctor writes a prescription, that's okay, because then you're going to simply ask the pharmacist for their discount. Okay, they'll give you a discount, and if you want, which is what I would do, is I would ask for the Good RX discount. Good RX is a national discount firm that has discounts lined up at pharmacies, and you would then pay the lower price for the drug. Good RX typically gets you 20 to 35% off.
Okay. Now, you say that in about 96% of the cases that are called in, they are going to be taken care of in some fashion.
Yes. 96% of the calls that come in, because you're dealing with an ER-trained provider and provider team, it's the whole team as if you walked into an emergency room, but it's virtual. 96% of the time, because of their level of training, you're going to be diagnosed and receive a treatment plan on that first encounter is what it's called. On that first encounter.
I'm thinking through this thing. Why would any employer not want to put this plan in effect for their teams? Because I look at it, because we added it at Nationwide Southwest, as you know.
Yes.
So all the employees have it. We have saved in excess of $20,000 now.
Yep.
In a very short period of time that we've been on it. The employees love it. Mm-hmm. And here's another thing. It takes away from the fact that somebody wakes up in the middle of the night. They get the next morning, they call in, I got to go to the doctor. Mm-hmm. Now we've already gone to the doctor, the ER, right, and we've gotten our prescription. We're already taking it. We can still make work.
Exactly. So, Dennis, there's no reason why any employer wouldn't want to put this in as an employee benefit, especially if they have high deductible plans, because employees can't afford those deductibles, but you're shifting cost over to them with higher deductibles. You're putting over higher payroll deductions. The benefits to an employer are many of them. Number one is you're going to have a healthier workforce, right? Because people are going to get the care they need when they need it for $0 copay. Number two, you're going to reduce absenteeism because they're healthier. Right. When you reduce absenteeism, you're going to improve productivity. We were talking to a member of yours earlier. He has four delivery guys. So 4 trucks out on the road because they're backed up all of the time. If one has to go and take the time to go to a doctor, everything is messed up. He said, with this, David, they call in from the truck if they need to, or they call in from home and they get the prescription that they need. So you have healthier employees, happier employees, reduced absenteeism, improved productivity. And what it does to your renewal potentially is because, like your team uses it because it's so easy and they enjoy it. You're reducing the amount of claims that an insurance company has to pay. So a good insurance company would say, okay, fine, we just saved $20,000 in claims. Maybe your renewal increase doesn't have to be so much. If you're a larger company and you're self-insured, this will have an immediate impact on your claim costs. It'll reduce your claim costs significantly.
All right. So we've gone through many of the different areas here. And when I look at it, I take a look at an employee and I say, okay, there are 40 hours in a week for a full-time employee.
Yes.
All right. We have 52 weeks in a year. That is 2,080 hours a year that we're paying for it. Okay. And I'm looking at the cost. So what is the cost for our member for a standard plan?
For the, you want to do it on an hourly basis?
Oh, yeah.
On an hourly basis, ladies and gentlemen, the cost basis to cover your employee per hour is 8 cents.
8 cents. 8 cents.
An hour.
8 cents an hour. And we can cover that employee and make in my way of looking at it, a much better environment,
Yep.
a healthier employee,
Yep.
an employee that will be at work.
Yep.
And you'll keep them. And tell me about the rest now. It's not just the employee.
No, it's exactly. It's so that 8 cents, Dennis, covers the employee, his or her spouse, and their children up to age 26.
In the same household.
In the same household. You file, if you claim them on your income tax, they're covered. If they're a college student and they're living at home, they're covered.
Oh, all right. So now I live in Texas. And right now I am in Florida.
Correct.
Okay. Now, right now I feel good. Maybe I'll go to sleep tonight and wake up at 2 a.m. and I've got a bad sore throat.
Yep.
Do I have to wait to get back to Texas or what am I going to do?
Dennis, I love your questions. That's a great question. So this is operational in all 50 states. It follows you wherever you're at. So if you did wake up tomorrow morning and you weren't feeling well, you access it via the urgent acute side. You'll receive a call back in under 30 minutes from a provider. They'll make a prescription. You call it into the local Walgreens and pick it up. So it follows you wherever you're at in the United States. You don't have to worry about finding an emergency room or urgent care center. It's right in the palm of your hands.
All right. Now I got another thought. So I have some children. They're now going to college.
Yes.
But they are under the 26, right?
They're up to 26.
All right. They're under 26. Now they're going to college. They would still be covered?
Yes. Yes, it is. For those of you that have college students, okay, they're covered underneath your membership because this is a membership to that virtual practice. It is the easiest way for your students to get care when they need it, whether it's physical or health care. Or whether they need to talk to somebody for mental support. They do it from the privacy of their dorm room. They don't have to learn about your plan, mom or dad. They don't have to worry about a deductible or a copayment or what's in network or what's not in network. They simply use the app or they click in via the web and they access care that way from their dorm room.
Good Lord. So we have got to get everybody engaged in this. We got to at least get everybody educated on what is available to them.
Yes.
Because like you said to start with, my God, these insurance premiums and stuff and the co-pays and all the stuff, people are our team alone in a short, I think, 4 months now.
4 months, yep.
Has saved just over $20,000 in co-pays and things like that.
And in bill charges, exactly right. Can I bring up a topic that's very important?
Yes.
So you have to, please know that people may tell you that this is not a good thing. And you have to wonder why there's that conflict of interest. And what I spoke about yesterday at the Learning Academy is that insurance companies want claims to continue to come into them because they want their doctors to receive payment. This is an independent medical practice. It doesn't matter who your insurance company is. The only thing these doctors and these providers want to do, Dennis, is take care of the patient. There's no rules. There's no formulary for them to follow. Okay. There's no order for tests, right? They're the MacGyvers of care, and they want you to get healthy. And so this is an independent practice that sits above any carrier. And watch what it does for you folks. If you're with Aetna today, you have the virtual medical practice for $12 to $15 per employee per month, and you move to United Healthcare tomorrow, this medical practice goes with you. It gives that consistency of care that people want. And I meant to say this earlier. On the urgent acute side, Dennis, you're going to get whatever doctor's on call that's licensed in your state, okay? For the primary care and the mental health care, you as the patient get to decide what kind of doctor you want to see. Do you want male, female, English, Spanish? And once you meet him or her for the first time, if you want to continue with them, you can. It's called continuity of care. No other platform out there does that. Nobody.
Well, all I can say is after going through this, listen to all the things you've had to say, David, and all of the advantages that this can bring to our membership.
Yes.
We have got to get this message out, and we got to get it out loud and clear. Okay. And that's what we're going to be doing.
Well, thank
David,
you very much.
Thank you so much for coming by here today,
Absolutely,
my Lord.
Dennis.
This
Thank
has been incredibly important, and we're going to work hard to get this thing done. And you have a nice day, sir.
Thank you, sir.
Thank
You
you.
do the same.